Hello and welcome to the third and final video on this introduction to congestive heart failure. In this video we're going to go over the treatment of congestive heart failure. And we need to remember that congestive heart failure can be caused by many different cardiovascular events or different problems, and trying to determine that underlying cause can be difficult. Is it due to the aftermath of a heart attack that left their myocardium damaged, or is it due to long-standing high blood pressure that caused more stress on the heart, which caused it to dilate and overstretch, and thus is no longer pumping efficiently? That's very difficult to kind of determine, and we won't go into those details in this video. But regardless of the cause of congestive heart failure, regardless of why someone's heart is failing, not generating enough pump action to meet the blood flow requirements of the body, there's three main things that we want to address in these people. So one, through drugs or different interventions, we're going to want to try to decrease the stress. We want to decrease the stress on the heart. And this stress on the heart we talk about is kind of been brought on by the increase in the total peripheral resistance. So there's been vasoconstriction of our blood vessels caused by the renin-angiotensin system. And this increase in the total peripheral resistance increases the amount of force the heart's going to need to generate. It's going to make the heart need to generate more force to eject blood, which ultimately increases stress on the heart, and that's not good. So we're going to want to address that. Two, we're going to need to somehow kind of address the fact that our heart has a reduced contractile force, or excuse me, contractile ability. So it's unable to produce the force that it once was able to due to that damaged myocardium, and so we're going to need to somehow, if we can, intervene. And fortunately, there are drugs that are out there that can help us actually increase the contractile force of the heart therapeutically. And thirdly, symptom we need to, or kind of set of symptoms we need to address are the ones that are caused by the fluid overload. So someone with congestive heart failure is likely going to be have fluid overload because the renin-angiotensin system has gone into increase the fluid retention in our kidneys by decreasing the urine output. So our body's going to be conserving the fluid when in fact it shouldn't be. And this fluid overload is going to cause that pulmonary congestion. And we're going to want to somehow try to decrease this fluid overload therapeutically. So ultimately, these are three different things that we're going to want to address. And in the next part of the video, I'll go ahead and talk about the different ways we can do that. So a helpful way for us to remember all the different things that we're going to be able to do for a patient is that we want to unload them. So this mnemonic will help you remember all the different interventions that we can use to help alleviate their symptoms. So we're going to want to have our patients sitting in upright position. So we're going to want to have them sitting upright. And this will ultimately allow gravity to work on our side and pull the fluid down. And that's important. Remember, we have a person who has fluid overload. Their fluid can be found in their pulmonary system and in their systemic, and with gravity we'll have the fluid be pulled down to the lower extremities, which will hopefully ease the shortness of breath and help them sleep. Second, we're going to want to put them on drugs called nitrates, or nitroglycerin is a common one. And these nitrates are potent venodilators, so they're going to dilate the veins of our body, and ultimately that decreases the stress on the heart. It will also, another effect it has is it will actually increase dilation of the coronary vessels, and those are the vessels that are actually delivering oxygen and blood to the heart, which is good. We want more oxygen to get to our heart, so that's a kind of a bipotent treatment. For our male patients, we're going to also probably want to recommend that they not use Cialis, because that may cause an unsafe drop in blood pressure. 3, we're going to want to treat them with a drug called Lasix, or furosemide, which is a diuretic. And diuretic, what means we're going to want to diurese them. What does that mean? Diuretic is something that will increase the urine production, which will ultimately help decrease the fluid. So our body's going to start urinating more and kind of get rid of the fluid that we've had built up. So that's Lasix. We're going to diurese them. Next, we're going to want to give them oxygen. This is more a case-by-case basis, but oxygen could really help someone who's hypoxemic, meaning they're having trouble getting oxygen to their brain and to their body, so they could be suffering from bad bouts of dizziness or fatigue. So giving them some oxygen will hopefully alleviate some of those issues. The last two here are very important, not more important, but are more therapeutic interventions. And we're going to want to remember that being ACE inhibitors and ARBs, angiotensin receptor blockers. So that's ACE inhibitor, that's angiotensin converting enzyme inhibitor. So that's going to insert itself into that renin-angiotensin cascade and decrease the conversion of angiotensin 1 to angiotensin 2, and that's very important. And then angiotensin receptor blocker is actually going to block angiotensin 2 from binding its receptor. So those both are going to interfere with the renin-angiotensin system. And we know that the renin-angiotensin system, although very important for in normal physiology, is a culprit for people who have congestive heart failure because it's going to increase fluid retention and make it and exacerbate the fluid overload. So ultimately, this will decrease fluid retention, and that's extremely important. So for patients with congestive heart failure, you're almost positively going to give them either an ACE inhibitor or an ARB. There's a cool drug called digoxin. It's a therapeutic agent. It's in the class of cardiac glycosides, which have a very cool and potent activity, very unique activity, in that they will increase contractility of the heart. So this drug will affect the contractile fibers in the heart, the contractile muscle fibers, and through a unique kind of mechanism that we won't talk about here, but I believe is covered in another video here on the Khan Academy, that it actually will increase the contractility, and that's extremely important. We'll have an increase in the stroke volume, which we haven't talked about since the first video, but increased stroke volume will increase the cardiac output. So as we said, this is a very important thing for our heart, is to be able to pump more blood out, which ultimately will get blood to the brain and to the heart, and to the muscles and all the other tissues, which is something that a patient with congestive heart failure is lacking. So all of these things are things that are interventions that we can use to help our patient who's in the hospital, feel better. We're going to want to pull fluid down, maybe help decrease that fluid overload in the pulmonary system and help them breathe better, feel less shortness of breath. We're going to want to also address that fluid overload by diuresing them, so increasing the urine output, by decreasing our salt retention, so we're going to ultimately decrease the fluid. Thirdly, in addressing this fluid overload, we're going to want to give them ACE inhibitor or an ARB, which will interfere with the renin-angiotensin system, decrease our fluid retention. So here we're trying to unload this person of their fluid overload, and then addressing more of the decreasing the stress on the heart. We're going to want to. Oh, and I forgot to mention that when you interfere with the renin-angiotensin system, not only are you going to decrease the fluid retention, you're going to decrease that peripheral vasoconstriction, which is very important for decreasing this total peripheral resistance that's causing the heart to be undergoing more stress. We're also going to want to increase the venodilation, increase the dilation of the coronary vessels, getting more oxygen to our heart. We're going to want to increase the contractility by using digoxin. So a patient will receive digoxin, and their heart will start pumping with a little bit more force. We'll have an increased amount of blood ejected per beat. That's the stroke volume, which will ultimately lead to an increased cardiac output, which is ultimately what we're lacking, or what a patient is lacking when they're suffering from heart failure. So that's going to be very important. And lastly, a treatment that we're going to want to go ahead and use outside of the mnemonic are called beta blockers. So we're going to want to treat heart failure patients with beta blockers. And as the name sounds, these drugs are going to block the beta adrenergic receptors that are on our heart. And these receptors are the downstream signalers of the sympathetic. So this is where the sympathetic nerve fibers are going to synapse are at these beta adrenergic receptors. So we're going to decrease the activity of a sympathetic branch of the nervous system. And that's going to ultimately, as we discussed about in the last video, we're going to decrease the heart rate. And we're also going to actually decrease the total peripheral resistance by causing vasodilation. So the blood vessels throughout the body will dilate and decrease the resistance with which the heart has to pump against, which will ultimately reduce the stress on the heart. So that's another very important drug that we're going to use to help someone with heart failure. And that's it. Hopefully you're ready for the next time you see a patient with congestive heart failure and you're able to make their day a little more comfortable. Thank you, and until next time.